the best part, I think, over the years since I've been in the league, guys being more willing to, okay, I'll go through this baseline. I'm okay. If I'm okay, I'm okay.
You found that. You found that recently that's happening.
Over time, it's been easier for guys to just come out and just, because you see it. You're watching guys, leave the league because whether it's injury to their heads or not, what's going on? It's kind of alarming to that point, because again, I think more players are more aware of how their bodies are feeling, and they get to a point where, okay, I can't allow this anymore. I can't keep this up because I'm going to harm myself even more if I keep going. So a lot of guys will, not struggle with coming out of the game for a play. I'm okay. I'll be okay. I'm okay. But still, it's a tough decision to make, but it's not always up to us once that helmet gets taken away.
Right. That's true. Yeah.
So you go through it, you do it. Hopefully you're out for a couple days.
Right.
You don't want to miss another game.
Right.
But everyone is going to be responsible for themselves. Yeah. Especially at this, you're old enough to know. We know what we're supposed to be looking for.
Right.
And if you can go, you can go.
You feel that's general knowledge right now. Is that
absolutely.
That you,
especially
you know what to look
in
for
the NFL.
At this point?
There's too much. They've given us too much resources to,
to overwhelm.
I mean, it is kind of overwhelming.
Is it? So, in terms of repeated concussions, right? Because I think that's what we keep alluding to. Why it's like so serious in NFL, right? Like we already talked about, like in the short term, why you should let people know about a concussion, right? But what about like in the long term, where you're having like these repeated concussions and things like that? Like, why is that such a big deal?
Well, we know we've known for a long time that head injuries aren't good, right? I think there was a time when we didn't fully recognize concussions as a head injury, or we thought that it's a head injury that's going to recover 100% of the time. And we know it's not 100%. It's high, 80, 85, 90% people, recover. But some folks don't get all the way better. But I think one of the things that we've really learned from research in the laboratory, as well as from studies of athletes, is that if you have multiple concussions and they're occurring very close to each other, the brain doesn't have enough time to recover biologically. And that's a little different than concussions that might be spaced out far apart. So if you were a football player who played from when you were very young, and maybe you had 3 or 4 lifetime concussions, but one was in high school and one was in college, and maybe one was if you were professional or something, but they were spaced out, and because of concussion protocol or because of other things, you stayed out and didn't have repeated injuries. The consequences of that seem to be less than someone who may have 2 or 3 concussions that are occurring in rapid succession, and they don't have a chance to recover in between. And it turns out we find the exact same thing in the laboratory when we do experiments with rats, and you see when the injuries are occurring too close for recovery, then there can be longer term consequences. If you space them out far enough, it seems like there's not really a magic number. It's not like 3 strikes you're out, 3 concussions you're out. It depends on how close were those concussions to each other. What was your recovery like? Some people recover really quick. Some people take a longer time. So I think, we're learning more about that. But one of the things that the concussion protocols tend to do is they tend to, once you're diagnosed, it tends to take longer now to get back than it used to. Right. And that space is important because that's what space the brain needs to get itself back online.
Yeah. Right. So not necessarily the amount of concussions, but you would say the amount of time between concussions is probably the most important to be able to avoid the big 3-letter word.
Right.
CTE. Right.
Yeah.
So what, there's a lot of talk about CTE. There's a lot of concern, I think, about CTE. What is something that you would want to kind of educate people on CTE?
Well, I think the first thing is for people to know I mean, CTE is a bad thing, and we don't want people to get it, and we don't want people to get, sort of repetitive head trauma without there being time in between. So that's for sure. I think we also have to be careful because at least right now, the way we understand CTE is it's not something that's easily diagnosable without looking at your brain tissue, right? All the cases we hear about in the medical papers and in the newspaper are looking at people's brain under a microscope. And so we can't diagnose it before people have died. So that's a big limitation, and that's a big challenge. I think the other part of the CTE story is that many of the symptoms that people who ended up having CTE expressed that, that they had these symptoms while they were alive, those are actually common symptoms that a lot of people have, okay? And particularly people who've had concussions. So persistent headaches, memory problems, not sleeping right, having mood problems. Those can be due to CTE. Those can be persistent post-concussive symptoms. And of course, they can be other things. You could have migraines. You could have depression. You could have anxiety. And so I think probably the biggest message I like to get out about chronic symptoms is that if you're having chronic symptoms after a head injury or after playing contact sports for some period of time, really get checked out by medical professionals who know what they're doing. Maybe it's CTE, but it could also be a lot of other things, and many of those other things are treatable. We see lots of folks, including retired athletes, but also youth athletes who end up having untreated migraines, or they have a vestibular problem with their balance. They have anxiety or depression. Sometimes, in years past, we really pushed hard to treat concussions by doing total brain rest or cocoon therapy and not letting people go out and do anything. And since then, over the last 5 or 6 years, we've really learned that when we tell people to be inactive, we actually prolong their recovery. It takes longer for people to get better if we tell them to sit in a dark room and do nothing, right? So now I think the field is moving toward it's okay to go back and use your brain when you're recovering. It's okay even to do physical activity. Maybe you don't go back to hitting heads right away, but you start jogging, you do a stationary bike, you get out and get some fresh air, you walk the dog, you swim, you start doing things, and that physical activity actually helps the brain recover, And I think that's an important message. So people who have chronic symptoms, I think don't jump to it being CTE and don't get depressed about that you think there's nothing you can do about it. Get it checked out, figure out what the things are, and then get the treatment for those things. And we see a lot of folks get better when you try that approach.
Hey, if you enjoyed that clip, check out the full episode on our YouTube channel. Don't forget to subscribe. Don't forget to follow us on social media. And most importantly, stay safe and be well. Thanks.